So now we want to talk about the rights of the people in the health sector to embark on industrial action. They have no right whatsoever to embark on any strike. Yes, you heard me right. Those people in the health sector, the medical doctors, the nurses, the physiotherapists, the pharmacists, the medical laboratory scientists, everybody in the health sector have no single right to go on strike. Somebody will say, what is this madman saying? After all, Section 40 of the Nigerian Constitution gives every citizen the right to freedom of association, form a union and all those stuff like that. Yes, that's fine. And also, they may also tell me about the Articles 87 of the International Labour Organization Convention and principles that equally empowers workers to go on industrial action. They may go ahead to cite sections 41 and 42 of Trade Dispute Act, to tell me that, yes, those workers, whether it's initial or none, have about 15 days or thereabout to issue an ultimatum, inform the government of their intended action, of their intent to embark on a strike when other solutions, dispute resolution mechanisms are failed. They may cite those ones. But I want to tell you that your law is not absolute. But when I say not absolute, means it's not always right. At times, your law can be varied, restricted, or more or less suspended temporarily by the government. So says Section 45 of the same Nigerian Constitution we have cited. So now, let's look at the relevant laws. First, the National Health Act, Section 45, classifies health under essential service. Simple. And Section 2 of the same National Health Act is clear. It says you cannot disrupt public hospital because of your strike. So the public hospital must be running. You have no right whatsoever to disrupt it. Fine, let us move a little bit. Let's go to Trade Union Act, Section 31, subsection 6. It's clear. It listed people that cannot go on strike. That involves essential service care providers where the health workers fall into. Then, for us to understand essential service providers, we go to Section 48, subsection 1 of the Trade Dispute Act, which defines what essential service is all about. Now, when you go to the first schedule of the same Trade Dispute Act, it listed organizations that fall, different professions that fall under essential service providers. Then, that is why Trade Union Act Section 11 clearly states that those essential service providers are not permitted by law to register a trade union. They gave examples like armed forces, the police, customs. You saw ETC. ETC there lists all the people mentioned under Section 48, subsection 1 of the Trade Dispute Act, and also under the first schedule of the same Trade Dispute Act. Now, let us look at some decided cases. First, in 2010, the Attorney General of Enugu State took NAG-MDP. NAG-MDP stands for National Association of Government Medical and Dental Practitioners. Took them to court because they had effrontery to issue 21-day ultimatum to the government that they wanted to go on strike and all those things. But they didn't know that Sullivan Chime, the then governor of Enugu State, was a lawyer. He was the Attorney General of the state during Chimaroke's time, and he did his job very well as the chief law officer of the state. That was why one of the reasons that Chimaroke chose him as the governor of Enugu State. So when they issued the ultimatum through the Commissioner of Health in Enugu State, talking about their comments, consolidated medical salary, scale or scheme. Now, at the end, when they brought the issue, the governor look at it, say these people, it be like say they know something. Make I teach them some relevant laws that they need to know. First, took them to National Industrial Court, the NAG-NDP, that you have no right to threaten going on strike. Who you be? Otumeje will say, who you? You understand? So you have no right as a healthcare, because you fall under essential service providers. You cannot go on strike. If police cannot go on strike, army cannot go on strike, navy cannot go, air force cannot go, customs, and so on and so forth, they cannot go on strike. So why should you threaten to go on strike? After all, Section 42 of the Nigerian Constitution is clear. They cannot discriminate anybody. So some essential service providers cannot go on strike, like those people printing currency, working in Beriagram and all those stuff like that, then why should you think of strike? Are you no longer essential service provider? Or do we have sacred cows now in the government? So in that situation, they went to court. When they went to court, the both parties appeared. And one of the arguments that the NDP brought is very laughable. They said, why are you quoting why are you quoting Trade Union Act? But we are not trade union. They said yes, but issuance of ultimatum is one of the operations of trade union. And the courts told them that, look, listen, that you are not a member of trade union does not mean that you can the principles or the laws of Trade Union Act cannot be applied on you, because the Trade Union Act is not only for the registered trade unions. It also applies for people like you that are from the back door enjoying what trade unions are doing. And it's even illegal for you to do that. The courts, showed leniency, because they would have, fined them for other things by even saying that you are even supposed to hide that one. You understand? So at the end of the day, the court held that, as based on section 31, subsection 6 of the Trade Union Act, and by the interpretation of section 48, subsection 1 and first schedule of the Trade Dispute Act, they have no right whatsoever to go on strike. So their threats, their whatever, their intention, whatever, is unlawful. And if any of them had gone there, as is most imprisonment based on section 41 of the Trade Dispute Act. So that's by the way. Then also, there was another decided case, like the National Union of Electricity Employees, that went to court and took Bureau of Public Enterprise to court. And court had the same thing, that you fall under essential service provider. So how dare you threaten us that you are going on strike? So it's clear. Those people under essential services cannot go on strike. And the health workers are among them, based on section 45, subsection 1 of the National Health Act, defines where health falls. 2, then section 45, subsection 2 is clear. You have no right to do that. So because of this, we've seen it. And finally, let's see the one. There was one Wike did. It seems that many people didn't know about it. Yes, when Wike was governor, the Association of Resident Doctors in BMH stands for Brentwood Memorial Hospital, which currently answers Rivers State University Teaching Hospital, Arusut. Now, the Association of Resident Doctors in the hospital threatened Wike with similar thing. Wike called them. I hope you know, say I be lawyer. Now Wike did something as a lawyer. Our people say that if snake does not behave like a snake, of course, little children will use it to tie, firewood. So what Wike did was very simple. Wike took them National Industrial Court. Wike showed them the new act, which is called this Trade Dispute in bracket Essential Act. That is Essential Services Act. Trade Dispute bracket Essential Services Act. Now, what does that one say? Section 1 says the government has right to prescribe any association, any people under the essential health services that even threaten to go on strike, or that is, if they go on strike, the government has the right to prescribe them. So immediately they went to the National Industrial Court. Wike did apply section 1 of the Trade Dispute in bracket Essential Services Act and prescribed Association of Resident Doctors in Arusut, and that was the end of the matter. So make sure that you like this page, comment, and share for other state governors, to see it, and other government in different levels. The health workers cannot be threatening you. When I say health worker, I mean the medical doctors, the nurses, the medical laboratory scientists, the physiotherapists, the pharmacists. Blame them, all of them. You can't go on strike. And section 42 have quoted it, does not allow you, because if the police order essential service provider, police, army, navy, air force, customs, road safety, those printing currency, and that is national security printing and minting company, you understand? If they cannot go on strike, then you cannot go on strike. Please, the next video, I'm going to tell you how you can get all your demands without disrupting the hospital legally. You can't be disrupting the hospital. Some of the health, some of the private hospitals depend on the public hospital, because based on Rule 29 of the Code of Medical Ethics, when a case is beyond, you refer to a higher center. What if the center is on strike? Let's talk about what of the cancer patients. Somebody can travel far away. Let's assume you travel from Yenegua, you are going to Zaria, or you're going to Ibadan for your radiotherapy. You reach there, they say doctors are on strike. But remember, this is your radiotherapy, you have courses. The time you're supposed to receive the next one. So it means that you have disrupted it, not because your inability to pay, not because of your inability to do the right thing, but because of the selfishness of people around. So if you think that you are not, government is not doing well, in the next video, that's why you need to share this one. Now in the next video, I will teach you how to get all your demand. In fact, government will be begging you and say that they will respect you. Thank you. See you next video. Thank you once more.